Hi, welcome to Fit for Life Sports Medicine. I'm Dr. Hayes, and do you ever wonder why ACL injuries are so prominent these days in the news? Everyone from Zac Efron to Jontay Porter are tearing their ACLs. On today's show, we'll discuss exactly why that happens and what you can do about it. Stay tuned.
I'm Jamison Williams. I attend Carnegie College Preparatory High School in St. Louis, Missouri. I'm a wide receiver committed to the University of Ohio State. I see a lot of great things in Dr. Hayes. She get me loose when I'm running my routes. I feel agile. Also on the track, it's the same thing, so I'm really loose running my races.
I'm Dr. Connie Hayes with Fit for Life Sports and Rehab. If you want a competitive edge on the field, call me, 314-532-0957.
Hey, let's check out this park. Oh, wow, that's really cool.
To find a great local park or forest near you, go to discovertheforest.org.
Hi. Hoping for a crisp breeze to help keep you alert. Oh, he took a sip of water too. That'll probably help. You were probably gonna turn down the radio too, so you could focus, right?
Probably okay isn't okay.
Right?
If you see a warning sign, stop and call a cab, a car, or a friend.
I think the water line is what really drove it home. I blew on
It's hard to go without cash, even for a short period of time. That's why it pays you cash quickly. You can use the cash to help with essential things like your mortgage, your groceries, or you can use it to help with unexpected costs like transportation to the doctor or childcare while you're trying to get well. Aflac offers a wide range of policies that fit most budgets. So if something like this happens, you can protect things like this and help provide your family with a safety net. Get Aflac in addition to your major medical and let them work together to help protect your family. Aflac.
Welcome back to Fit for Life Sports Medicine. This is our Nerd Jock segment. This is a fun segment where Travis Seal, serving as our Nerd Jock, is going to give us some fun facts about ACLs. Travis?
Ancient Egyptians were aware of the anterior cruciate ligament. The first reconstructive surgery was in 1918. U.S. surgeons perform over 200,000 ACL surgeries annually.
You guys, at some point in your career, your love, football, has been taken from you.
Yeah.
Right? Yours through an injury.
Yeah,
so
recently.
you want to tell me a little bit
Yeah.
about like your injury and then really how it made you feel?
Yeah, I got you. So, he was actually there when I heard it the first time last year.
Mm-hmm.
But, it came back around, it didn't heal properly. So, during track practice, I was at the Elite Combine. I felt it when I was going through one-on-ones. And at first, it was like raw emotion, like, dang, like, well, how long would I be out? Is it really going to hinder me coming up to the season? Do I have to get surgery, this, that, and the third? That's all the questions going through my mind. Now, I'm at a point now, I've been going to rehab. I'm walking good now. I'm totally fine up here. I calmed down. I feel like I'm gonna be ready for the season. You know, it's not that much of a hurry like it was at first. So I'm just taking this slow so I can be ready for the season.
Well, tell me what it was like though before you had your calm down. What were your steps? You know, how did you?
I was rushing it, if that makes sense.
Well, what were your mental calisthenics? Like, you know what I mean? What was going on in your head?
It was like at rehab, I was just like, keep going, because sometimes, you know, the pain don't want you to, you want to keep it, you know, keep it down, but, you know, I have to lift my leg up, you know, it's my hip flexor, I have to use it to walk, so it was just like, keep going, don't stop, you know. Like when I first did it, it was like, dang it, but now I'm kind of cool now.
Yeah. Was there a time when you were physically okay, like you tested out good, but you still didn't think you were?
Yes.
And tell me how you got through that gap then.
Particularly, let's see, right before I did it, I did broad jump, and like I tested well, and everything was good. You know, I was feeling great. I think I jumped like a 9.5 at the combine. I was feeling great. Then it was one-on-ones next, and I did my route, and I got the guy, I planted, and the quarterback overthrew me, so I tried to speed up, get to the ball, then I felt it, and it was like, ooh, you know.
I'm Jamison Williams. I attend Cardinal College Preparatory High School in St. Louis, Missouri. I'm a wide receiver committed to the University of Ohio State. I see a lot of great things in Dr. Hayes. She get me loose. When I'm running my routes, I feel agile. Also on the track, it's the same thing, so I'm really loose running my races.
I'm Dr. Connie Hayes with Fit for Life Sports and Rehab. If you want a competitive edge on the field, call me, 314-532-0957.
Hey, let's check out this park. Oh, wow, that's really cool.
To find a great local park or forest near you, go to discovertheforest.org.
Hi. Hoping for a crisp breeze to help keep you alert. Oh, he took a sip of water too. That'll probably help. You were probably going to turn down the radio too, so you could focus, right?
Probably okay isn't okay.
Right.
If you see a warning sign, stop and call a cab, a car, or a friend.
I think the water line is what really drove it home. I blew on him.
Welcome back to Fit for Life Sports Medicine. Joining us today in the studio is Eris Bowen with Elite Orthopedics. Eris, welcome.
Thanks for having me.
Oh, it's awesome. So I met you during an ACL surgery, and I'm going to tell you, I was so impressed with the knowledge that you had. I thought you were a surgeon. So
I wish my surgeons thought that. That would help me out.
I found out later that you're not a surgeon, but tell me a little bit about what it is you do.
So I work for Elite Orthopedics. We are an exclusive Arthrex distributorship here in St. Louis. And essentially I'm a medical consultant. We don't like to use the term salesman or medical sales rep because that's really not the name of the game, right? You know, we do all of our homework and we do enough research on our own time that when we come to the OR, it's really just to help the surgeon treat their patients better versus trying to push a product or trying to sell something or get them to use a new widget. We have plenty of widgets, don't get me wrong, but...
Yeah, I saw some widgets.
Yeah, right, but at the end of the day, it's just, you know, we're doing everything we can to make the surgeon operate either more efficiently or just put another tool in their toolbox to help them treat their patients.
So you brought a lot of tools with us, with you today. So tell me what you're going to share with us about ACLs, ACL surgery, and what all
What
of
all
these
this
fun
is?
things
What all
you
what all
have
these
here.
widgets
For,
are?
yes,
Okay.
exactly.
So when you're talking about ACL surgery, we're talking about anterior cruciate ligament, and that's the main ligament that keeps your tibia from sliding anteriorly. What I mean by that is you have your femur, or your thigh bone, and then your tibia, or your shin bone, right? Okay. And to keep it from translating this way, your ACL engages. Okay. Right? It also gives you some rotational stability as well, and you kind of see that when you're seeing the reconstruction, just because how it's associated in the joint. Okay. Now what I have here is it's pre-drilled, a sawbone. Figured that'd be easier than getting a bunch of sawdust everywhere, right?
So that would have been fun.
It could have been fun. It'd been like arts and crafts, right?
Right.
And you know, speaking of that, I mean, this is essentially carpentry of the body. Oh yeah. Like it's human carpentry.
I've always thought that when I witness surgeries, I'm like,
it's way cool. Yeah. Right. So we've kind of
just
figured it out.
Just more expensive tools.
Exactly. Yeah. Exactly. And the biggest part of this is getting your placement of where you're going to put your graft. Okay. So if you see here, you got your tibial tunnel on. It's listed as the most lateral aspect of the anterior horn of the medial meniscus. Which is a lot to remember, right?
Yeah. Now you're sounding like my nerd jock.
Right. Right. Well, and what you'll find is that when you get in the joint, all this is done arthroscopically, which means it's done just through little cameras in here. Is that you see the native ACL where it attaches at the tibia and also where it attaches in the femur. Okay. So whenever you take down the torn ligament, you kind of have your footprints where you want to go, right? You have a good landmark because you want to be as back to the native ACL of X patient as possible, right? Regardless of where, you know, all the data says you're supposed to be verbatim, right? You know, I mean that
because everybody is unique.
Everybody's different, yeah. Right? So you have your data where you know you're looking for, but when you get in there and they start trimming out these ligaments, you know, you see where their native ligaments are supposed to be, and then you can kind of aim for those, right? Yeah. So, and what makes it nice is that now we've gotten to a point where this can be done with 3 little bitty incisions. Just 3 tiny incisions. It used to be a huge arthrotomy or a huge cut from your tibia to your femur, and then we moved to a 2-incision ACL, which was a cut on your tibia and then another cut on the lateral aspect of your femur, and then we actually moved to a transtibial. Okay. Transtibial was through the tibia, and then you actually drilled through this hole up in your femur.
And that's kind of what you have here.
It's kind of, the tibial hole is, but what they found is that those grafts sometimes were a little too vertical. So we moved backwards to that 2-incision, right? And then now with, you know, everything's evolving, right? So
what does a 2 vertical graft mean to me as a player?
So a 2 vertical graft would mean you have stability, anterior, posterior, front and back, but your rotational stability isn't where it should be, right? Because we found that the ACL is an oblique ligament, right? So that's how you want it. You want it to stay that way. Okay. So we moved back to the 2-incision, and then as everything progresses, and everything, you know, like we mentioned, iPhone 2's working, and now it's iPhone 10, right? Right. So the iPhone 10 is the all inside, and the all inside just gives you just little incisions. Okay. And you're passing the graft through those incisions, and you're drilling through those, and you're actually drilling inside out versus outside in. Which is pretty cool.
Too easy,
right? And one thing I brought is it's what's called a flip cutter. Okay. So this is one of the, I mean, this is all inside. This is your go-to. This is your workhorse. Okay. And what's nice is that these guides tee you up to put this in the right place. Okay. So these hook right inside, and your sleeve comes down to your bone. Hold this a little better for the camera. But you see these hooks, they come in your portals, and they just hook right where you're supposed to go.
That's pretty good.
Okay, so then you can see where you're firing, right?
So the end result is I get prettier knees, like less scarring, and a more stable surgery.
Yeah. A more anatomic ACL, and less of a cosmetic footprint.
Okay.
Exactly. You just got three little nicks.
Thank you for being here. Thank you for sharing with us.
Absolutely. Yeah, my pleasure.
We'll be back with more Fit for Life after this.
I'm Jamison Williams. I attend Cardinal College Preparatory High School in St. Louis, Missouri. I'm a wide receiver committed to the University of Ohio State. I see a lot of great things in Dr. Hayes. She get me loose when I'm running my routes. I feel agile. Also on the track, it's the same thing, so I'm really loose running my races.
I'm Dr. Connie Hayes with Fit for Life Sports and Rehab. If you want a competitive edge on the field, call me, 314-532-0957.
Hey, let's check out this park. Oh, wow, that's really cool.
To find a great local park or forest near you, go to discovertheforest.org.
Do you have enough cash to protect you and your family in the event of an illness or injury? Do you have a safety net? This is Major Medical Insurance. We all know that it's something our family shouldn't live without. If something unfortunate happens, it helps cover most of our medical expenses like our doctor's bills or prescriptions. But while you're focusing on getting better, who's helping with the other expenses in your life? The important things. The things your family needs and cares about.
Welcome back to Fit for Life. Joining us in the studio now is Dr. Richard Lehman. Doc, hey.
Thank you for having me.
Oh, it's awesome. Always good to be in your company, man. So,
likewise.
You are going to share with us about ACL. So go ahead and kind of first tell us what is an ACL, where is an ACL, why do we need it, why do we care?
So that's probably the hottest topic right now in sports medicine is anterior cruciate ligament injuries. Lots of famous people have injured their anterior cruciate ligament. Adrian Peterson, Sam Bradford, many athletes have injured their ACL. And the ACL is in the center of the knee. So femur or your thigh bone, just like Era said, your tibia, your shin bone, and this little white thing in the middle is your anterior cruciate ligament, and it stops your knee from doing two things. It stops your knee from coming forward, and it stops your knee from rotating. So most ACL injuries are derotational injuries. You're running, you plant your foot, you twist,
right,
and you feel a pop, have excruciating pain, knee swells, and boom, you've torn your ACL.
Okay. Talk to me about a little bit about, well, I have to go here. Jontay Porter.
Yep.
So he tears his ACL back in October. He re-injures it a few months ago. How on earth does that happen?
Well, I think there's two things that happen. Number one, I think that most cases are going to be you're just not adequately rehabbed. So you've gotten your range of motion back. Maybe you've even gotten your strength back, but you haven't gotten back to sport-specific activity, i.e. basketball,
right,
or football or lacrosse or soccer, whatever. So that's the first thing. The second thing is there could be a technical glitch. Maybe the graft, as Aris had talked about, isn't in the perfect position, or maybe you didn't get all your knees straight in terms of range of motion, or maybe your quad strength really wasn't where it needed to be. So those are the two issues. But I think in most cases, these athletes really have not completed their rehab in terms of getting back to their sport. Their strength is pretty good, their speed's pretty good, their ups are pretty good, but they haven't really done all the things they need to do to play at that level.
They're anxious to get back.
And they want to get back. And they're telling the coach, you know, I'm ready, let's rock and roll.
I'm done, I'm ready.
You got it.
Okay, so how long does rehab usually take? How long does it take for me to recover from an ACL injury?
So in 2019, you have to figure it's going to be 4 to 6 months, and that's really rehab to where you've done your drills, then you've done your sport-specific activities, you've practiced, and now you're really ready, prime time to get back at it.
Okay. So if I suspect that I've torn my ACL, take me through what I have to do to confirm I've torn an ACL.
That's a great question. So basically what happens is you have an injury, you maybe feel a pop, or maybe your knee just swells. After a day or two, the swelling doesn't really go away, you're still having some pain, something just doesn't feel right. So you go to your doctor, and they're probably going to refer you to an orthopedic surgeon or a sports doctor. They're going to x-ray your knee, they're going to examine your knee, and I would say 9 times out of 10, just from the exam, they're going to tell you, Dr. Hayes, you've torn your anterior cruciate ligament. Now, almost 100% across the board, they're going to want to get an MRI of your knee, which is another type of x-ray, and that's going to confirm or deny whether you've torn your ACL and have you torn something else in your knee, because about 80% of the people that tear their ACLs are going to tear one of these little meniscuses or cartilages in the knee.
Okay. How important is it that my orthopedic surgeon be a sports medicine orthopedic surgeon, like a sports guy, you know?
Another good question. So medicine is kind of like playing the piano. If you play for 5 hours, you're 5 hours good. If you play for 10,000 hours, you're 10,000 hours good. So I would say in a high-level athlete, a good high school athlete, a good weekend warrior, you probably want to go to somebody who is specifically trained in sports medicine.
Okay.
All orthopedic surgeons are not specifically trained in sports medicine. Maybe they do backs, maybe they do hands, they do fractures, but you probably want to go to someone who's doing primarily sports medicine. In our practice, we do about 5 ACLs a week, so pretty common procedure, pretty common injury. And I do think it's important to go to somebody who's doing this all the time, just like if you want to get your car fixed, you want to go to somebody who's fixing that type of car all the time.
Right. So what are my options on types of surgeries? Just, you know, I know we got autografts, allografts. Talk to me about different types of surgeries.
So autografts are taking your tissue, and there's really 2 types. One is to take a soft tissue graft, and that would be using your hamstrings, which in a basketball player would be a bad idea, right? Because you got to jump up in the air, and you kind of need your hamstrings. Or to take your quadriceps tendon, a portion of your quadriceps tendon, which is the big tendon in the front of your knee.
Okay.
Those are soft tissue grafts, and those are your tissue. The other option, which is the most common, is to use a patellar tendon, your kneecap tendon. And you use the central third of the tendon, and you use bone at both ends. And I would say in most cases, a sports medicine guy is probably going to do a bone patellar bone graft, your tissue, in a high-level athlete. Now, the other option is to use a cadaver. So the cadaver is harvested from, sounds terrible, but a dead person, and they take the graft, and they use the same thing, a bone tendon bone.
Right.
And that graft is a readily available graft. So we have them in freezers, we have them ready to go. And in a lower demand athlete, maybe you're a 45-year-old skier, you play softball, you're a runner, you don't need as much demand on your knee, you might be able to get by with what's called an allograft or a cadaver graft.
Okay. We talked a little bit about how is the surgery different for a youth athlete because of the growth plate. So talk to me a little bit about that. What is the difference? What do I have to be concerned about?
So the growth plates close right around 13 to 15 years old, 13 in a female, 15 in a male. And what's the problem with doing the surgery across the growth plate is the leg can either stop growing because the growth plate's violated, or your leg isn't going to grow straight.
Okay.
So based on that, you don't want to cross the growth plate. So if the athlete comes in, their growth plates are open, you have to make sure that you don't drill a hole, as Eris was talking about, one of these tunnels across the growth plate. So what do? You miss the growth plate and go through what's called the epiphysis. You change the angle of the reconstruction and make sure that you're not crossing the growth plate. Now, if you have a son or a daughter out there and they're young and they tear their ACL, they should have their ACL reconstructed. You don't want to wait till their growth plate closes because they're going to do other damage in their knee. So it's important to go to somebody who's very comfortable doing these epiphyseal or reconstructions with the growth plates open, and make sure you don't violate the growth plate. You don't want your leg to grow kind of crooked.
Right. Well, Dr. Lehman, thank you for all your good information that you've been giving us about ACLs. If we have some athletes out there, or no matter what level they're at, tell me how they can get in touch with you to get more information.
So my name is Richard Lehman. I'm at the U.S. Center for Sports Medicine, and you can either call us 314-909-1666 or go to our website, the U.S. Center for Sports Medicine.
I'm going to do the same for you. Go ahead and give us your information about how to contact you.
Yeah, so Elite Orthopedics, I don't remember the phone number off the top of my head, so you had to Google it. But as far as I'm concerned, I'm just A. Bowen at EliteOrthoLLC.com. So if you have any questions or anybody wants to reach out, they're more than welcome.
So I want to thank both of you gentlemen for being here. It's been a great pleasure talking with you guys about ACLs and surgery, reconstruction, and what people can do. Rick, real quick though, you had said ACLs were like an epidemic almost, and I thought that was pretty important. So I just wanted to say, and I think you guys would agree, rehab is most important. After your surgery, you want to be really on point with doing your rehab. Would you agree?
Well, I think in sports medicine in general, rotator cuff tears, Tommy John surgery, rehab's everything. Sports guys love rehab. But in ACLs, it's particularly important. You got to get your range of motion back. And that's, you've worked with plenty of ACLs. You know what happens when that doesn't happen. You want to get your strength back, and you want to get your function back. So for listeners out there, please do your rehab, do your home exercises, listen to your doctor, listen to your therapist, and be on point, kind of stay ahead of the game, and you'll have a great result. If you don't do your rehab, it's like not doing your homework.
All right. Thank you, gentlemen. This has been Fit for Life Sports Medicine. Thank you guys for joining us. We'll see you next time.